And now we'll continue with this theme. It will be continued by Dr. Robert Schneider, an internationally recognized physician, scientist, educator, and leader in the field of science-based integrative medicine. Dr. Schneider did his postgraduate training in internal medicine and hypertension at the University of Michigan Medical School. He is a specialist in preventive medicine, hypertension, and preventive cardiology. In 2005, Dr. Schneider was honored as a Fellow of the American College of Cardiology. Beginning in 1984, Dr. Schneider was one of the first physicians in the United States to practice, teach, and research the Maharishi Vedic approach to health. Over the past 30 years, Dr. Schneider has directed or co-directed more than $25 million in grant support from the U.S. National Institutes of Health and Department of Defense for clinical research on Vedic healthcare. The results of these studies have been published in 150 peer-review articles. Based on his groundbreaking research and clinical experience, Dr. Schneider authored the popular book, Total Heart Health: How to Prevent and Reverse Heart Disease with the Maharishi Vedic Approach to Health. Currently, Dr. Schneider is professor and director of the Institute for Natural Medicine and Prevention and dean of the Maharishi College of Perfect Health at Maharishi University of Management, USA. Please welcome Dr. Robert Schneider.
Pranam Shankaracharya, Maharajaji, Mr. Chairman. With the encouragement of the organizers of this conference, I'll be presenting two talks back-to-back this afternoon, Vedic Healthcare Part 1 and Vedic Healthcare Part 2. In Vedic Healthcare Part 1, I'll be talking about the total approach to health, the Vedic approach to health, validated by modern medical science, reviewing much of the empirical research sponsored by the U.S. government and related agencies. In the part 2 of this talk, I'll be reviewing what to do with this knowledge and how to implement it in building institutions for Vedic healthcare. But first, what is the problem with health in India today? Minister Nayak, in his introduction presented to us, talked about the epidemic of diseases of modern society in India. Cardiovascular disease, that is heart attack and stroke, are the leading causes of death in India as they are in the West and globally today. What are the causes of cardiovascular disease in India and everywhere else? This study shows the major risk factors for heart disease from the largest international cardiovascular disease study called InterHeart. The blue bars show conventional risk factors: smoking, diabetes, hypertension, obesity. That ApoB, ApoA1 means high cholesterol. Notice the red bar. That shows the contribution of psychosocial stress, the role of the mind to heart disease. It's been recently discovered that the role of the mind, the contribution of the mind to heart disease, is as great or greater than conventional physical risk factors. Well, this comes to the point of view of the Vedic approach to health. Because in Ayurveda, there are 3 levels of contribution to health in the relative field, all based on the absolute field of the unified field. These 3 levels that contribute to health are the environment, or in Sanskrit, Daiva Vyapasriya, from the architectural environment to the distant environment to the far environment of the universe around us. The second level that contributes to health is physiology or body, in Ayurveda called Yukti Vyapasriya. This is the level of physiology, the doshas, the dhatus, the agnis, that Ayurveda conventionally talks about, or most of us conventionally associate with Ayurveda, and with modern medicine. This is biochemical medicine, as Dr. Hagelin talked about. The third level of contribution to health, defined by Ayurveda and elaborated by Maharishi in 1964 in The Science of Being, is the level of the mind. And this corresponds with the previous discovery of modern science. In Ayurvedic terms, the mind contribution to health is called sattva vijaya, the knowledge of the mind and its relationship to body and health. Sattva vijaya could also be called Vedic psychiatry. All three of these levels are connected to the unified field, and it's the purpose of the Vedic approach to health to restore balance on all these three levels in respect to each other, and ultimately balance with respect to the field of perfect balance in Atma, or the unified field. Today, or in this first part, I'm going to focus on Sattva Vijaya, Vedic approach to health, particularly addressing the number one cause of ill health in the world today and India, cardiovascular disease. Now, I'm not the first one to review Sattva Vijaya for cardiovascular disease. Actually, the first modern medical body, the first conventional medical organization in history of modern medicine, to review the Vedic approach to health for cardiovascular disease, as well as other alternative approaches to heart disease, was done by the American Heart Association and published in 2013. And this is the cover page of their article, Beyond Medications and Diet, Beyond the Conventional Methods, looking at alternative approaches. In that, they reviewed behavioral methods, including meditations, stress reduction, biofeedback procedures. They reviewed more mechanical procedures, acupuncture, and devices like breathing devices, kind of like mechanical pranayama. And they reviewed exercise, arguably alternative. They did a critical analysis of these methods for lowering blood pressure. They created a summary and guidance for doctors for the first time on how to use these methods and which ones work and which ones don't. And they made recommendations for future research. I think I'll jump to the conclusion first and work backwards on how they came to this conclusion. They said, in the end of their report, alternative treatments that include the transcendental meditation technique, Vedic meditation, are recommended for consideration in treatment plans for all individuals with blood pressure greater than 120/80. Now, how many adults have blood pressure over 120/80? Almost all. Actually, majority of adults, 60% of adults, nearly 2/3, have blood pressure greater than the ideal range. Out of those 2/3, half or 1/3 of all adults have established hypertension. The other 1/3 have what's called pre-hypertension. So in India, that accounts for many hundreds of millions of people for whom the American doctors would recommend transcendental meditation for their heart health. Now, why would this meditation, this Sattva Vijaya Vedic approach work on the heart? Well, modern neurophysiologists, or actually this new field of neurocardiology, has described the brain-heart connection, largely through the autonomic nervous system, although there are many other connections. I'm sure Professor Nader could elaborate on the brain-heart connections for us today, but let us just know that it's an established neural connection on how the brain can influence the heart and blood pressure. How does that roll out in terms of clinical effects, which is our focus today? This is the first randomized controlled trial, these highly regarded experimental modern studies, which was done on various forms of mind-body intervention for high blood pressure. The top line shows a group of patients with hypertension who were randomized to an education control group, EC. They received conventional guidelines: reduce salt, reduce weight, get more exercise, and reduce stress. Second group received instruction in a generic relaxation technique called progressive muscle relaxation. Third group received instruction in transcendental meditation. Second two groups were matched for placebo-type effects, non-specific effects, expectancy, time, home practice, and enthusiasm of instructor, or qualifications of instructor. As you can see by the line showing changes in blood pressure over 3 months' time, there was no change in the conventional lifestyle group, in this case, which is common. Doctors recommend all those lifestyle changes. Most patients don't do them. Second group, generic relaxation, had a small reduction in blood pressure. Third group, the transcending group, had a large change in their blood pressure, as large as some medications for the treatment of high blood pressure. Fast forward about 20 years, there have been 11 published randomized controlled trials on transcendental meditation and blood pressure. They have comprised more than 1,200 subjects. Large data analyzed in this sort of mega-analysis or meta-analysis done at the University of Kentucky, showing that both systolic and diastolic blood pressure, the top number and bottom number that your doctor tells you, 140 over 90, 120 over 80, systolic over diastolic, these reductions are clinically significant, statistically significant, and alone could prevent rates of heart attack and stroke by at least 25% in the population. Another very important study that was acknowledged by the American Heart Association in its review was a comparison of all the published scientific studies on all of the available stress management, relaxation, biofeedback techniques, and combination therapies that combined various ones of these. These were all the strong, well-designed randomized controlled trials. 170 were screened for this analysis. When you look at those well-designed studies, which have the same criteria that governments use now for new medical therapies, in the US, the Food and Drug Administration, for example, the relaxation, stress management, biofeedback, and combination therapies are NS. What does that mean? Not statistically significant for their effects on blood pressure. However, when the studies on transcendental meditation are subjected to the same rigorous criteria, the results remain highly statistically significant for their effects on blood pressure. This meant a lot to the doctors who independently reviewed this data, because their job was to figure out what works and what doesn't. And they concluded, and this is their words, these are their words, the transcendental meditation technique is the only meditation practice, including MBSR, that means mindfulness-based stress reduction, which is popular today, is the only meditation practice that has been shown to lower blood pressure. The results of other techniques are either negative or insufficient to make recommendations at this time. So they singled out the regular experience of samadhi, or the atma, as the most effective way to prevent heart disease and lower blood pressure. Hypertension, while the single most important risk factor in the world for the #1 cause of mortality, is not the only risk factor in the world. There are others. Diabetes is rapidly increasing in India with modern lifestyle. Overweight, diabetes, and heart disease often go together. This is a study of the precursor of heart disease, metabolic syndrome, and the precursor of diabetes in metabolic syndrome in heart disease patients. This was a randomized controlled trial sponsored by the US government, published in the Journal of the American Medical Association, now called JAMA Internal Medicine. In this study, the red bar represents the changes in the control group over time. Blue bar represents the meditation group. As you can see, there was a relative reduction in insulin resistance, and that you don't want to resist your own insulin. That causes diabetes. So there was an improvement in this pre-diabetic condition simply by mind-body intervention alone, without changes in diet, without changes in exercise, without changes in drugs. Now, lifestyle changes certainly have their value and are there in Ayurveda, but this shows the power of the consciousness physiology connection alone. The bottom line for patients is how long do we live and how often do we stay out of the hospital? Technically, these are called clinical events: lifespan, mortality rate, MI, and stroke. So this next study is the culmination of 10 years of work looking at clinical events. This cost the National Institutes of Health about $5 million. I don't know how many rupees that is, but many crore rupees. And it was published by the American Heart Association in this journal, Circulation, Quality, and Outcomes. In this study, our colleagues at the Medical College of Wisconsin and MUM Research Institute recruited 200 patients with heart disease, randomized half of them to meditation, half to control education, all continued their usual medicines, and we more or less sat back and watched them over 10 years to see how long they lived and stayed out of the hospital. As was mentioned earlier, but described in more detail now, the group practicing transcendental meditation had nearly 50% reduction in their rate of combined death, heart attack, and stroke compared to the control group. Now, if a colleague of ours, Dr. Norman Rosenthal, who worked for the NIH, likes to say, if this were a drug and marketable by industry, this would be a multi-million-dollar blockbuster drug. However, rather than a drug from without, this was using the body's own internal pharmacy, we could say, to prevent death and serious disease. In summary, this penultimate trial showed 48% lower clinical events with reduced blood pressure, which was one of the mechanisms for reduced heart disease, also reduced psychological stress over this period of time in the patients, and there was a dose-response relationship. That means the greater the dose of TM practice, up to a maximum of 20 minutes twice a day, there's greater survival. And those who had the most regular practice had a 66% reduction in their serious disease rates. We're talking about the mind-body connection here, the mind-heart connection. What about psychosocial stress factors that contribute to heart disease? This was a randomized controlled trial done at American University in Washington, D.C. This was a highly stressed, high-risk group known as college students who were tested before and after one semester of their normal studies compared to control students. Half the students received instruction in transcendental meditation, and their changes in psychosocial stress are shown in the blue bars. They had reduced total distress, reduced anxiety, reduced depression, reduced anger and hostility, and improved coping ability. And this is the whole model of psychosocial stress, that if you increase coping, you reduce distress. And these subjects also had lower blood pressure amongst the high-risk groups. So that's the coping mind-body-heart connection. The latest frontier in medicine is genomic medicine and epigenomic medicine. We heard a little bit about that from Dr. Wallace. This slide is from the American Heart Association showing this new relationship between the gene, the epigenome, and the heart. The gene is our DNA. The epigene, or epigenome, are those molecules around the DNA that control the expression of the genes or the DNA, that turn on or off different parts of the DNA. And it's been found that this epigenome, on top of the DNA, if you will, is actually modifiable. DNA may be there for your whole life, maybe not from the Vedic point of view, but at least from the modern point of view, it's there. But it can turn on or off with your environment, with the air you breathe, with the food you eat, with your lifestyle, with a variety of behavioral influences. And these epigenomic changes can lead to disease or health. This is a study of epigenomic effects of transcendental meditation. This was a randomized controlled pilot trial done in collaboration with Dr. Fagan and his team and our group at MUM and Howard University in Washington, D.C., looking at two therapies. One, an established form of therapy for changing genetic expression, particularly for telomerase, which repairs the telomere, that repairs the DNA. And that's shown in the blue bars, showing that before and after intervention, these intensive lifestyle methods did affect gene expression for this repair mechanism, which was previously shown. The red bars were the first time to show that subjects practicing transcendental meditation who had high blood pressure were able to increase their own genetic self-repair mechanisms without major behavioral changes, without major changes in their lifestyle. Using their consciousness alone, they were able to turn on their DNA for telomerase self-repair. This could be a mechanism of enhanced longevity, slowing of aging, and reduced cardiovascular disease, and improved lifespan. The next frontier of Vedic healthcare is putting all the approaches together. Remember Charak, as recently elaborated by Maharshi, described you need to cover all the different levels. You need to cover the environment, and we'll hear more about yagyas and graha shanti and the relationship to health in today's session. We need to cover the body, and we need to cover the mind, and reconnect those three levels to Atma within ourselves. This was a study of doing a lot of that in older patients using a Vedic mind-body program, including transcendental meditation and Maharshi Ayurveda approaches together in a multimodality lifestyle program. And this study looked at thickness of the walls of the artery in the neck. The red bar shows the changes in the control group, blue bar shows changes in the Vedic healthcare group, showing dramatic reductions in the thickness of the arteries. Now, when you think about this, what it means is that these patients with the Vedic healthcare program were able to open up their arteries to regress atherosclerosis using these Vedic healthcare programs, which is rather unusual without changes in drugs or surgery. This could be a mechanism for the greater lifespan in these people. That is a brief survey of some of the modern medical research validating the Vedic approach to health, particularly for heart disease, and particularly with the Sattva Vijaya approach and a bit on the multi-approaches. Now, what do we do with this knowledge? Sure, we have 30 years or 40 years of scientific research. We have 600, or there are more than 600 published papers now. Now what do we do? Well, we have this conference today to think together with the leaders of the Indian government and other policy leaders of India how to apply this scientific knowledge of Vedic healthcare. My and our proposition to the leaders of the Indian government and policymakers is to establish health centers and medical training institutions for Vedic healthcare. And as you saw and see again, this is what they look like. This is the embodiment of Vedic health care in physical form that Maharshi designed with Vastu experts and all the health experts, where the integrative health centers and the colleges of integrative health care or perfect health are based, and from there, in every city, in every state, throughout the country, this knowledge can be brought to the people. And that is through 4 steps. And these are our 4 action steps for this conference today. Number 1, promote Vedic healthcare as an integrated system of medicine that utilizes modern science and ancient Vedic science. Don't throw either one of them away, but bring them together. If they're both describing natural law, then we should be able to make an integrated science from these modern views and ancient views, and each can help to elaborate the other. After that, after we have the paradigm clear, second, we should establish a network of Maharishi Integrative Vedic health centers to clinically provide these programs to the people. Third, we should establish a network of Maharishi College of Vedic Healthcare, or Perfect Health, to train the next generation, or even train the current generation of healthcare providers. Conduct more research, particularly here in India. Modern people like research, so let's do a large multi-center clinical research trial to further verify the effects of Vedic healthcare on reducing the number one cause of disease, both in India and in the West, cardiovascular disease. And I'll elaborate on each of these points in the next few minutes. This represents what I call horizontal integration of healthcare. Represented here are different disciplines of healthcare. We have modern approach, or the allopathic approach on the left. In the center, we have the Vedic or Ayurvedic approach to health. And then on the right-hand side of your screen, you see represented other systems in the Ayush ministry of traditional, indigenous, and natural systems of medicine, which have their own traditions and their own scientific validation. Usually, these departments don't talk to each other. In India, I've been to hospitals. A few hospitals have departments of modern medicine, which is like 80 to 90% of the hospital, and there may be a wing of Ayurveda medicine, but they don't talk to each other. I gave a lecture in Nepal at a big medical university there. They had schools of Ayurveda, schools of modern medicine for who knows how many decades, and then the talk that I gave on integrative healthcare, for the first time they came together in the same room to hear about integrative healthcare. So what we're proposing is to bring the best knowledge and practices of modern medicine, where they're useful and have minimal side effects, together with Ayurveda as an integrating paradigm and other systems of natural medicine, and have a panel of experts review every patient. What would it be like if you had a health condition and you had a panel of 10 experts review your case? Actually, they do this in the Mayo Clinic, but only from the allopathic point of view. 10 experts representing world medicine. What is best for you? What combination of therapies would be most useful for prevention, least side effects, most rapid cure? And then this panel would create protocols for all the conditions, as well as review all the patients. So that's a cross-discipline, multidisciplinary, cross-disciplinary. That's what we're calling horizontal integration. That's dimension one. Dimension two of integration, we're calling vertical integration. Every national healthcare system includes tertiary, secondary, and primary healthcare. Tertiary is the university referral hospital. Here in India, that's Apollo Hospital, that's Medanta. Those are the AIMS hospitals, one in every region, or maybe a few in the country, where the super specialists are and all the high-tech equipment is. Secondary healthcare are the community hospitals and community health centers. Maybe those are the 15, 20-bed places, more in the smaller cities and smaller towns. Third level is primary healthcare. These are the sort of barefoot doctors, or the Vaidjas in every village, or the family doctors, or the nurses in every school. These are the frontline healthcare providers. Usually these people don't talk very much to each other either. You have the super specialists in the big city, and a patient can go 100 kilometers or a few hundred kilometers, and maybe a few months later there could be a report that comes back, but usually there's very little give and take. But what if these three levels of healthcare, from specialist to secondary provider to frontline person, what if they were working together as a team? What if they were coordinated with each other? And what if they all work together for your individual healthcare? This would be a second dimension of integration. And this, again, is what we're calling vertical integration, tertiary, secondary, primary healthcare. Now that's pretty good. Now what if you put those two dimensions together? You had this cross-disciplinary horizontal integration simultaneous with this vertical integration of the team-based healthcare. Wouldn't that be a unique form of healthcare in the world? There are some healthcare theorists who are talking about this or hinting about this as the next generation of healthcare. But Maharishi envisioned it in the early 2000s, and he designed this program for this. And there's a third dimension even on top of that. There's the tripod of medicine: clinical practice, education, and research. Most people think of medicine as clinical practice. That's certainly there as the front line of medicine. But how do doctors know what to do? And where do those doctors come from? Well, they come from the medical education system. That is a limb or a corner of the tripod. And where does the educational system get its knowledge from? Well, it has to come from knowledge. It has to come from the discoveries, either discoveries of ancient medicine, of traditional medicine, or discoveries of modern medicine. And this is actually a loop. If you can have a looping triangle, we should ask our mathematicians about that. But this is a self-interacting loop, if you will. Education for clinical practice, research informs education, education informs practice, and practice actually, in turn, reinforms and contributes to research. That's the threefold tripod, or the tripod of medicine. I've been talking a bit about clinical practice. The Maharishi Colleges of Perfect Health are the education form of that tripod. And then for the research part of it, that's a whole huge area, but specifically as an action step for India, what we're recommending, and actually is pending a proposal with the Department of Ayush now, is a study called Veda Hearts. This is a study of Vedic healthcare in heart attack recovery trial, HART. And this proposed Veda Heart trial, it's one, there could be many, would be the largest international study ever of Vedic healthcare approaches, 4,000 patients, post-MI, could be a reasonable population, multi-center throughout India, could even be multinational. Patients would be randomized to transcendental meditation, Vedic approach to experiencing restful alertness, creating mind-heart connection, to Ayurvedic approaches in a second group. Third group would be putting the mind-body approaches together. Fourth group would be the control group. And we would look at hard outcomes at the end over time. The high cost, high utilization, patient-oriented outcomes of healthcare, which means how long you stay alive and how long you stay healthy and functional, as well as intermediate measures of health that could contribute: blood pressure, cholesterol, and stress. So that's a bit about our proposal for research. And then we talked about education and clinical practice. Now, this is what the model looks like putting it all together. This is the Maharishi Vedic approach to integrated healthcare on a national system, for a national healthcare system for India in this case. This is a system of healthcare that has cross-disciplinary, holistic approach to its knowledge of health, multidisciplinary, team-based approach to healthcare on the tertiary healthcare level, where we're recommending these tertiary healthcare hospitals in every major urban area, Vedic community hospitals in every smaller community, and Vedic integrated health primary care clinics in every community. And all these practices would be linked by their connection with practice, continuing education, ongoing education in the Maharishi Colleges of Perfect Health, and also kept all up to date and avant-garde in their practices through ongoing research. This total integrated approach to a national healthcare system is what we mean by this system of Maharishi Colleges of Perfect Health and Maharishi Health Centers, which should be the next step for India in leading the world for ideal health. Namaskar.